Well, I would encourage you to watch Dr. Giseki's video. Dr. Anders Tegnell and Dr. Giseki are brilliant. They are infectious disease statewide epidemiologists that have been done this for decades. If you watch their material, it's brilliant. They said, listen, the Swedish people are smart. You know, we kids under 16 are in school. Businesses are going. There's some social isolation. We're restricting groups to under 50. Other than that, there's not much other restrictions. And their death rate is 225 per million, and the United States is 175 per million. So, and again, you cannot say who really had the best strategy until this thing is over. My point is really, if we're going to shut down the economy, let's make sure we're using good science. And when I listen to these epidemiologists, they say sheltering in place and social distancing does not work, and there's not good science. And we have to ask ourselves, is the collateral damage of shutdown causing more harm than the virus itself?
I want to ask you about the herd immunity issue. You know, Sweden has come under fire for this too, but the whole concept of vaccination is based upon herd immunity. Enough people have antibodies in their system that they actually fight off the virus. In the case of Sweden, that seems to be more of the route they went to, right? Which was to say, we're going to go this route and we're going to essentially put ourselves in a position where we can say enough people have it and eventually the virus chokes itself out. That method has been criticized extensively here as if a vaccine is the only answer to this. And yet you made some really important points, I thought, in your news conference when you specifically talked about some of the weight of this sheltering in place in terms of child abuse, spousal abuse, unemployment, possible suicide. I mean, there are a lot of other factors from a health perspective that are not being considered right now. Why is that?
Well, because we don't have good data on it. And people tell me, well, you're just, that's just conjecture. You're just throwing things out. I say, well, this is what I'm hearing from my colleagues. I talked to Dr. Jason Lang in Wisconsin. I talked to Dr. Witkowski, who's a biostatistician, and I've asked him about numbers and what we should do and data. So I'm talking to a lot of people and trying to relay what I'm hearing. I don't have a double-blind, clinically controlled, peer-reviewed journals because it's only been 2 months. Those things take time. So I'm saying with what we've seen, with the science we know, with what we're hearing from the chief epidemiologists in different countries who are having great results, did we make a good decision? We're causing the secondary harm that you mentioned, all those things. I'm getting patients calling me, asking me for alprazolam, anti-anxiety medications. They're depressed. They're upset. This is happening on a daily basis. And I'm going, did we make the best decision? Or should we take the model of Sweden and say, let's start backing this down. Let's open up the schools first. Let's take a stepwise ladder approach, which is what Dr. Giseki mentioned. Open the schools, see how disease and death move forward. And if it's a normal uptick of the cycle, our curve is flattened at this point. And if it stays flattened and starts going down, let's open up the economy slowly and methodically. We've never done this before. Nobody has a playbook to say, here's how you open up economy that's shut down. So we're winging it a little bit. And I think the science for shutdown, I haven't seen it. If it's out there, would you please send it to me?
Well, and that becomes the whole issue as well, right? That, as you said, this has never been done before, and it's not even as if there was some kind of example in history where you could say shutdowns have worked this way, but especially for a virus that we didn't know much about. So even if you make the argument that early on, we didn't really know what we had here, and so if you give politicians the benefit of the doubt, but it seems like politicians are not listening to doctors in this process, that they're making a lot of their decisions unilaterally, and they're telling hospitals and doctors to respond to them. And you made another point in your news conference, I wanted to ask you about this, where you said we are setting ourselves up for a very dangerous situation where we have lots of other health issues happening in this country aside from coronavirus that are being ignored. Meanwhile, doctors and nurses are being furloughed right now. So how do we deal with an oncoming, almost onslaught of other medical conditions when we have damaged not just the economy as a whole, but the healthcare and medical economy?
I talked to a doctor in Wisconsin 2 days ago. I did a Zoom interview with him, and I said, Dr. Lang, what are you noticing in your hospital? He said, I'm having patients come in for chest pain 3 days late because they're afraid of COVID. I'm having people with abdominal pain come in late with much more severe problems than if they had come in day one. Why? Fear. They're thinking, I don't want the COVID. So we have hospitals with low census. We have ER doctors losing hours, nurses losing hours. And when you open up an economy, we know we're going to get more cases, and the staff just isn't there. I called my CEOs in Kern County yesterday. I said, how's your census? They said low. I said, how's your surge capacity? They said high. They said, we're sitting around waiting for patients. Our volume is incredibly low. So we've created this situation where everybody's on high alert. The tents are out. Staff is ready. And there's 14 cases in all of our hospitals in Kern County of COVID right now.
In terms of dissent, and I don't want to label you as a dissenter, but certainly as a medical professional, part of your job, part of your responsibility to your community is to report what you see going on around you, right? And to help to clarify data. You kept talking about, this kind of raw data dump, but that raw data dump, when we start to see it happen in multiple places, we get a better picture of what's actually going on in terms of a virus. The fact that YouTube took that video, that news conference that had, over 5 million views on it, I mean, tens of millions of people have viewed this news conference, but the fact that they would take that down, and I'm assuming they didn't contact you and say, can you verify what you're saying or get some clarification for it, the fact that they would take it down as if you are doing something that they would call harmful or dangerous when you're simply reporting the facts of what you see, does that give you pause in this process? I don't want you to be political about it, but does it give you pause in terms of just from a medical standpoint being told you're not allowed to have a dissenting medical point of view?
I took a Hippocratic oath when I decided to be a physician. And the one thing they asked me was, do no harm. And when I see patients in my practice being harmed by locking themselves in their house, they live alone, they're not seeing their church friends. They're not going out. They're lonely. They're depressed. Alcoholism is on the rise. And many things like this, I say to myself, I am now doing harm. My patients are calling me saying, do I have to stay in my house for weeks? I live alone. We are now doing harm. And so the key to, what I would say to YouTube is we have to be careful that we don't stifle those of us that have the patient's and the country's best interest in mind. I'm not trying to go against what anybody is doing. What I'm trying to say is let's make sure we use good science, and let's make sure we take cues from countries that are having really good results like Sweden. Let's not think that we have all the best answers. Sometimes it's best to get all of our minds together and make a good decision for the country, because this lockdown has caused so much collateral damage. I think we all can agree it affects everyone in a negative fashion.
Yeah, and the last thing I'd ask you, I appreciate, again, your time on all this, but the last thing I'd ask you is, in terms of the response from other doctors and nurses, because one of the things that I keep hearing from people is that medical professionals do not agree with these doctors. But that's not necessarily the case, correct? I mean, you have heard from medical professionals, have you not, from around the country who say, keep going with this because we're seeing the same thing?
Well, yeah, I actually have. And I've talked to Dr. Witkowski is a master's in biostatistician, and he's been doing these medical analytics for 20 years, as is Dr. Gisecki. I'm taking my knowledge from epidemiologists. Certain doctors, this is not my area of expertise, so I'm deferring to them saying, this is what they are telling me right now. I interviewed Dr. Witkowski. If you go on our Facebook, you can see it. It's 20 minutes of him saying there is no evidence for some of the things we're doing. So I'm saying if we're going to cause significant harm to our economy and to my patients, let's make sure there's good science behind it before we sort of attack me. And a lot of physicians, we're getting hundreds of them that are calling in and saying, man, we're right behind you. We're seeing the same thing in Texas and in Wisconsin and New Jersey. So I just want to make sure that we're using good science and data and not just throwing stones and attacking people's credibility.
Well, Dr. Erickson, we thank you for your time and for taking the bold stand that you have taken. Again, for sharing data and science, factual data with us, rather than just pushing out an agenda like so many other people are. We appreciate you. And thank you guys for tuning in and for watching. If you're watching this on social media, Facebook or Instagram, please like it and share it as much as possible. And if you're watching this on YouTube, well, the fact is you're probably not watching it on YouTube, because the fact is the last story I did about Dr. Erickson's news conference has been removed from YouTube, just like his news conference was, because YouTube has decided that this information is not allowed to live on their platform. How disgraceful. Again, thanks for watching. Stay vigilant and stay tuned.